lives are at stake. This is a fantastically penetrating insight that it's easy to lose track of sometimes. We think of what's the dollar impact or what is the impact on efficiency, but lives are at stake. I'd like to open up the floor to the audience here for questions. I have plenty, but who has something that they would like? This is your opportunity now to talk to these guys. Ian, please.
Please do also share views, opinions, criticism. No need to ask anything.
Hi, Ian Oliver, University of Uvascular. Okay, so you made the comment about that a lot of companies sit in denial. It hasn't happened to us yet, and you should change that. Things like Stuxnet, SolarWinds, actually very, very easy to defend against. The technology's out there. These attacks would not have happened without technology that's already built into the operating systems, hardware, etc. We don't monitor for these because we're actually sitting in denial to say, well, we've never seen it happen, and we know it hasn't happened because we don't monitor for it. It's the Donald Trump. You know, if you stop checking for COVID-19, the number of cases goes to zero. But there was I believe she was a CSO of a major Nordic company, I won't say which, who said, after a data breach last year or earlier this year, basically said, we did nothing wrong, we have all the certification. We have ISO 9000, done everything. How do you answer that?
So, let's start with the first part, right? Stuxnet, SolarWinds, and so on. I wouldn't put Stuxnet close to anything. Stuxnet was a very elaborate nation-state attack created by professionals for many years with funding that unfortunately no private company has. So, that being said, the technology exists, and we're right. But everybody usually focuses on their business rather than the technology in order to make sure that cybersecurity is in a better place. Now, certifications exist for a reason, right? Being certified and having all the controls in place and operating them correctly is not necessarily true. Throughout my career, I also achieved certifications, but I knew we were not good enough. The way the certifications work, and the auditors, they come in and they say that they have a checklist, let's put it that way, and they go through the checklist. Once you manage to have adequate level on that checklist, you pass. Does that necessarily mean that in the eyes of a cybersecurity event or an incident you will be able to respond? Probably not. Because having the minimum requirements does not necessarily mean you are good enough, especially with motivated people, right? That would be my take on this. I would say people sitting in denial exist even nowadays. I do work with some major organizations that develop a lot of intellectual property, and there was actually one from the Asia region. I cannot share which one, but the comment was that we won't get breached because we're a very ethical company. This was literally a multi-million company. That was the comment. Guess what? They got targeted by mistake, and that costed them about 500 million in losses. So what they did afterwards, they invested similar amount every year, so about 10 to 50 million every year in order to bring their cybersecurity defenses to a level that this won't happen again. So denial won't help us, unfortunately.
Thanks, Ian. Next. Oh, great.
Hello. Yeah. First of all, thank you for the great, insightful presentation to both of you. I think my question would connect to both of the presentation is like, I would like to know, do we have any ideal zero trust architecture already available for health tech? And what are your views or experiences or challenges for a 0 day in health tech?
Okay, let me try. Zero trust is something that it is in one way rather useful sort of reference. I don't want to say framework because it's not really a framework. It's more about a set of principles that guide us to a operating model that has a higher likelihood of success in terms of cybersecurity. I would say that it's about that, and there may be a bit of sort of misplaced or maybe a misplaced expectation, possibly misunderstanding, because in the other side of the Atlantic Ocean in US, this terminology has been included in the communication by the federal president, guiding the federal agencies to implement the zero trust and so on. So hence the market reaction is that everybody has zero trust, but it's not necessarily something that you can trust the box. You should maybe look inside how the principles are implemented, and can it actually sort of provide what you're looking for. Plus that zero trust is not adequate by it's rather simple set of, because it's the Microsoft approach that I referred to is like those basics. So it's not enough to sort of manage the risk completely. In a similar way, as Vasileios just mentioned about the for example, the international certifications, it's exactly the same. If they would actually be very good procedural and technical reference frameworks, it would be easy to sort of also regulate. Just create a law and say that everybody has to have ISO 9000 whatever, or 27000 or something else. But they are not able to sort of be used as a total risk management frameworks. So that is essentially, they are much more useful in terms of sort of external communication, possibly, well, I don't want to say marketing, but to convince others that we have a process. And they of course serve a purpose internally to sort of make sure that the main elements procedurally are in place in the organization. So I think it's both of these issues in the same way. I don't know if you zero days exist a lot. I mean, every year there is roughly, I have to sort of pick this off the top of my head now, but I would say roughly maybe 15,000 software vulnerabilities are reported every year. So you can imagine the amount that exists in every other. And it doesn't have to be, for example, healthcare solution, because all solutions nowadays include for example, some element of open source or some other ready-made package of software, and hence it's distributed everywhere, like the Log4j that we just heard of. Yes.
I'd like to add on top of that. First of all, we are not playing down zero trust or the certifications, right? They exist, and they exist for a reason, right? The problem is that when we are taking these as the silver bullet to solve everything, Uber, which was right there earlier, had the zero trust model implemented, and a very good one. But they got breached through their support, which actually then found the passwords for the total management console. So zero trust and all the other controls are just a step towards the direction. We need to take a multi-layered approach to make sure that every time we are taking things away from the threat actor in order for them to achieve their goal. That's kind of, let's say, the approach. As of zero trust, 0 days, so there are two things right here. First of all, if we go back and see the most exploded vulnerabilities, they are not from the recent years even. They are from years back. The reason is it's easy to exploit, they exist right there, and usually organizations either neglect them or they are not aware of them. So if you're not aware of something, it's very hard to protect. Now, specifically for 0 days, or let's say healthcare vulnerabilities in total, you probably have heard a lot of DICOM vulnerabilities being exploited and so on. Those are not 0 days. Those are insecure protocols that we are using in healthcare because we need to, and because those are what we have. We also had, for example, earlier, the example that someone plugs in something, right? Medical device manufacturers usually require remote support. In order to have that remote support, someone needs to plug in or enable a port access for some organization to come in and provide that support. This is something we need. This is something we have. Unfortunately, we don't have enough personnel, IT personnel, to be in the positions we need to make sure that every hospital has a team of IT, a team of cybersecurity. I would be very happy if we had that. Unfortunately, we don't. I know hospitals that don't even have one IT person. Not even one. They operate without IT. They just make it work.
Thanks for the insightful presentations. Really nice. This question probably goes more to Peter. So it's not really related to security, but what you said there was that productivity hasn't been improving in Finland for 15 years, according to the graphs. And this just I've heard this before, but it's made me wonder. I mean, we know that digitalization projects, like I've been in software industry for more than 15 years and in IT industry, so I know that digitalization projects have been going on for at least 15 years. So what's going on? Like, is it so that the digitalization do you have any? Perhaps you don't have you probably don't have a fact or like exact answer, but what's your insight? Like, why don't these projects work? Or is there something else that comes in that sort of counters the work that is being done in all these digitalization projects?
Very good question, thank you, and a very difficult one too. Yeah, like I said, it's not a security question per se, but one aspect certainly links up with security is that at least in our sort of public sector, the development projects have not launched or progressed at the pace of what would, for example, be needed because of various concerns, be those contract management, be those security considerations. For example, using cloud technology, using public cloud. In Finland, we have all the facts of what, for example, hyperscaler, public cloud providers, how their security is really established, and what are the sort of residual risk elements that there are. We have those facts. But at the same time, we have public sector actors who simply did the more like, sorry for my being a bit blunt on this, but they did the Trump thing and simply disregarded, at least so far, of what the facts are showing. And even worse, if we are talking about private clouds and so on, it really has been like trying to move in a your legs are in tar that you're not able to move forward. That doesn't. But I can give you another like more precise example. This is from the law enforcement sector. For example, in Finland we have a lot of firearms. But they are strictly controlled, and we have few million, I think 2 million something firearms. We're only 5 million people, so every other person has a firearm. Welcome to Finland. they have digitalized the application process now, and it seems to be more or less sort of done deal. But now we are learning that what happens at the end. Now the applicant can use the website to apply for the carrying permit, but on the other end, it's still printing out the same documents and processing them more or less. Okay, maybe I'm exaggerating a little bit, but it's not really digitalized to the way that there would be, for example, automation or some elements that should be clearly part, because it's not. When you measure the productivity in, for example, in a firearm carry permit example, it is the citizen who is spending the time when they go to the local police station and wait until it's their turn to hand in the papers and so on. So there is no metrics essentially that somehow measures the productivity of the law enforcement permit apparatus itself. You understand? Still, despite of the citizen now being more, it's more easier for them to apply, which is great, of course, I'm not criticizing that. But the decision-making process, it takes exactly the same time. So what is the sort of productivity that you can then measure if you take out the citizen from the equation?
Thank you so much, Peter Sund, Vasileios, Mingos.